Hello everyone, welcome to our YouTube channel C&D Courses by Rani. In today's session, we will learn about the vitamin D, and without wasting much of the time, let's learn about the vitamin D. So first of all, vitamin D is otherwise known as sunshine vitamin, and it can be synthesized from sunlight in our body, or basically by our body. When the sun exposed to our skin, the vitamin D are synthesized by our body. Vitamin D is fat soluble, that means it is soluble into fats, not in water. Its ID group of different testosterone compound with anti-rachitic property. That means it helps to prevent the rachitics or helps to prevent rickets in peoples. They are the different ID groups are basically D, D2, D3. These all are the different groups of sterol compound of vitamin D. Let's learn about the function of vitamin D. Function of vitamin D tell us about the vitamin D itself. It is in inactive form. Basically, when vitamin D comes to our body, it is in the inactive form, and when it enter into our body, it's converted into active form to absorb in the body. It is concentrated in livers and minute quantity in the skin, brain, lungs, spleen, and kidney. Vitamin D promotes the absorption of calcium and phosphorus from the small intestine. Vitamin D, it is very important in such patients who have calcium deficient, who have bone problems or teeth problem, because vitamin D helps to promote the absorption of calcium and phosphorus through small intestine. In the DNA, vitamin D helps to form active calcium binding protein. It also maintains the concentration of calcium and phosphorus in blood. As we learn that calcium and phosphorus is equally helpful, or it is equally important. If the vitamin D is not present, the calcium and phosphorus will not able to absorb. Vitamin D helps the deposition of calcium phosphate in the bone. A vitamin D hormone is known as calciferol. That is, a vitamin D is a kind of hormone which is also known as calciferol. Now, sometimes most of the peoples are deficient of vitamin D. In such case, we pop up with supplements of vitamin D. Apart from supplements, what we can do? We can receive such vitamin D from the sources of vitamin D itself. The first source of vitamin D are fish liver oil, egg yolk, and those who are non-vegetarian, for these are fish oil and egg yolk. And for those who are vegetarian, milk, buttermilk, ghee are the best source of vitamin D. Ghee, which are desi ghee prepared at home, are too much essential. And next come to sardine and salmon fish, which are very best source of vitamin D among fish. Some brands of butter are fortified with vitamin D is also good for us. Sunlight is also known as a natural vitamin source of vitamin D. And vitamin D is absorbed from the intestine with the dairy fats or dietary fats, from where it is taken to the liver. Basically, when we learn that vitamin D is a fat soluble vitamin, that means vitamin D is absorbed only when the fat, which basically the very essential fat or a good quality of fat, is available in our body, then the vitamin D is able to absorb properly. That's why a good source of fat, a good source of desi ghee are important to absorb the vitamin D properly and synthesize or increase the level of vitamin in our blood. Now, what are the deficiency? Deficiency of vitamin D result in poor absorption of calcium and phosphorus. As in function, we learn that calcium and phosphorus are absorbed by the vitamin D. If vitamin D is not present in our body, then the deficiency of vitamin D result in poor absorption of the calcium and phosphorus, and this is excessive loss in the urine and the feces. The concentration of calcium in the plasma is diminished and it produces tetany, which is characterized by the hyperexcitability of the nervous system. When we not absorb the calcium properly, this leads to symptoms known as tetany, and it's characterized by the hyperexcitability of the nervous system. Now, sometimes vitamin D also leads to rickets in children, osteomalacia in adults. These all are the deficiency of the calcium and vitamin D, as it is not absorbed by the vitamin D properly. Now, there are two things which we learn or which we already learned somewhere, that deficiency of vitamin D leads to rickets. Basically, rickets and osteomalacia are these two terms which we use normally or generally in case of vitamin D deficiency. So show some light, throw some light in the that rickets is just basically which are found in infancy or infant or childhood, and osteomalacia which are found in adults. These both are the deficiency of vitamin D, but they are found in different age group. That's why it is differentiated by some others name, rickets in children and osteomalacia in adults. So I hope this session was useful for you all. If it is, then like, share and subscribe our channels to all those useful people or students. Thank you so much for watching, and for full notes you can mail us on the given mail. Stay tuned for such session. Thank you so much. Thank you.